Guys, this is just a quick video to let you know about the diploma in head and neck surgery. I was actually asked by someone to do a video about it, so I'm just going to do it. So the diploma in head and neck surgery, as you know, has two parts, part 1 and part 2. The diploma in head and neck surgery is offered by all 4 Royal Colleges. So the cost, £537 for part 1, and it's about £900 for part 2. I think there are some colleges that offer the exam outside of the UK, but for those of us living in the Caribbean, most likely we'll have to fly to the UK for our examination. You have 6 attempts for part 1, 4 attempts for part 2, and for part 1, which is a multiple choice examination, I think there's about 140 questions. Paper 1 is true or false, and paper 2 is extended matrix questions. The part 2 is an OSCE, which can be about 28 stations, and these 28 stations, they may go up to about 30 stations with 2 rest stations or so. And it's basically designed for those who want to go into higher surgical training in ENT, or those who are, like, for instance, a general practitioner who wants to have some focused experience in ear, nose, and throat. So the diploma in head and neck surgery allows you to then apply for a membership where you could have your MRCS ENT. If you have MRCS Part A and you combine that with your diploma in head and neck surgery, you can actually apply for your MRCS ENT exam, which is kind of needed if you want to go into ENT. So I hope I haven't left out anything. I'm just going to check my notes and see if I left out anything. For the part 2, there are 23 stations which are question and answered, while there are 5 clinical stations which have patients at the actual stations. As mentioned before, part 1 is the multiple choice, part 2 is the OSCE. So one of the things that I actually found very interesting about the diploma in head and neck surgery, unlike the MRCS examination, the diploma in head and neck surgery, you have to have at least 6 months. It's recommended that you have 6 months of ENT experience. Now, I don't know how that goes for dentistry, because with dentistry, technically you're doing a lot of ear, not ear, but you're doing, nose, throat. But my thing is, we don't do any ears in dentistry at all, unless you're talking about the face bowl, and you have the face bowl that goes into your ears. But other than that, we don't do any ears. So if we're looking to do the diploma in head and neck surgery, you're at a slight disadvantage as a dentist and a doctor. Well, if you have a dual qualification, because you wouldn't have done ear anatomy as in depth as an ear, nose, and throat surgeon. So you have to read up a lot. So that's what I'm trying to do. I don't know if the college itself wants you to show evidence that you have done 6 months of ear, nose, and throat surgery. So I have to call the Royal College of Surgeons to find out what they want from that point of view, and ask them if I could be exempted from that 6 months, since I've been doing, a lot of anatomy from the dental aspect of my training. But we'll see. As for higher surgical training in oral and maxillofacial surgery, I was informed that it really doesn't help you in terms of advancing in oral and maxillofacial surgery. But I think from my strategy, if I'm looking for a job in the UK, I can't expect to leave the Caribbean and go up there into the UK and get into an oral and maxillofacial post so easily, because, well, for one, I'm coming from a country outside of the UK, and my degree is outside of the UK. So what I'm doing is trying to get, the reason why I'm doing the examination is not only for knowledge, which I just love knowledge, but I'm doing it also because I'm trying to expand the possibilities of jobs that I can apply for. So if I apply for a SHO job in ENT, I could, because I have the diploma in head and neck surgery, I would like them to at least give me a second glance. I don't know if I explain myself well, but I think that's the strategy from that point of view. Also, if you're applying for things like facial plastics jobs, those things, the diploma in head and neck surgery or DONS examination, it can't hurt to have it. So I hope this helps. Keep subscribing. See Peppa Pig in the background. Hope all is well.